Hello friends, let us now learn this picture in Robin's pathology. So here you can see that this is the picture of kidney and this is the ureter. This is the ureter and this is the kidney. This is the renal pelvis. And you can see presence of here in the cortex, you can see presence of irregular scarring which you can see in the cortex of the kidney. And if you see, this renal pelvis is dilated a lot. So this is dilated renal pelvis is seen. And the ureter is almost normal. There is no dilatation of ureter. So here you can see that this is the ureteropelvic junction. So here there is ureteropelvic stenosis which you can see in this picture. Thank you guys for watching my lecture. Thank you.